We'll give everyone to 5 past and then we can kick off. Okay, do we want to kick off?
I think so too.
Yep. Okay.
I think everybody is quite busy these days, so
yeah,
might as well just kick off.
Yeah, and they'll join if they when they're ready. Okay, over to you, Walter.
Thank you very much, Hannah. So good morning, good afternoon, and good evening, and malo ilale to everyone. For those of you who don't know me, my name is Walter Harrell. I'm actually the CIO of the Ministry of Health in Tonga. I currently reside in Tonga as well, and part of the board members of the FIN. So my purpose here is to actually welcome you all. So on behalf of the FIN, the president, board members, advisors, secretariats, pretty much the entire team. I'd like to sincerely express our sincere appreciation to you all for taking time out of the very busy schedules, not only to attend this webinar, but to also support these initiatives that we've been undertaking in efforts to achieve one of our main goals, which is focusing on capacity building and inclusive growth, to inspire, encourage, and develop and enhance our Pacific Island countries to implement digital health. Part of the motive of going about this is actually conducting regular webinars, which are free of charge to different various topics. You want to make sure that our Pacific Island countries are aware of not only what is available out in the market, but also is appropriate for them, and also to understand and realize the benefits of using these digital systems. So given the current climate with COVID-19, we strongly believe that it's extremely important to focus our webinar today on digital immunization tools. I'm not going to go into provide you any details to it. I'll let our presenter do that. But what I would like to do is briefly introduce her to you guys. So our presenter today is Latifa Nezuela. I apologize if I'm pronouncing your last name wrong, so I apologize for that, Latifa. So Latifa is from Canada. She's one of the senior consultant at Jerity Consulting. Latifa is a registered nurse with a wealth of experience in public health. She holds a master's in health informatics and also public health. Currently working closely with WHO in several initiatives. And I had the privilege and pleasure to work with her and working with her. One of our main projects in the past, which is the implementation of our public health system, which is the Tupaya and DHIS2 as well. And last but not the least, she's a loving mother and a wife as well. So before I pass it on to Latifa, I would like to actually talk about just a few things, housekeeping. I would like to actually get you all muted. I think can be controlled as well by Hannah. And of course, if you have any questions, please just send them over through the chat room, or you can actually wait until we have our Q&A session after the presentation. So again, thank you very much and welcome to this webinar. I'll pass it on to you, Latifa. Please take it away.
Great, thank you, Walter. And you did pronounce my last name correctly. So good for you on that, because it's not easy. So I will just go ahead and share my slides. Just give me a moment here. Okay, so you should be able to see my slides. Somebody can just let me know.
Yep.
Okay, excellent. Thank you. And I realize I have the date as June 16th because where we are in Canada, it's the 16th, but for many of you, it's tomorrow. So as Walter mentioned, I'll just give you a little bit of background about myself and as well as one of my colleagues, Ava, who's also on the call. So yes, I do have a background in public health. I started my career as a public health nurse, and I've worked in the areas of communicable disease management and immunization management as a nurse in Canada. I kind of had a shift in my career from more frontline service delivery to public health information systems. And for about the last 10 years or so, I've been working on the implementation of public health systems in Canada. And I've worked both on implementing immunization registries for the provinces in Canada, but I've also worked on the product side, so for vendors in advising on product design and solutions. I've been fairly involved in the rollout of COVID immunizations in Canada, supporting some of the provinces, and as well as supporting them in their case and contact management solutions. So I'll also introduce my colleague Ava, who's on the call, and she's a fellow public health person. She's an epidemiologist by background, and she has been part of the team, along with Lauro and a few others on the call today, that have been working with the WHO on a data management project to support the Pacific Island countries in routine immunization data management and COVID-19 data management. So in terms of the objectives of the call today, so I'll provide just a brief overview on EIRs, so electronic immunization registries, and some of the benefits. I'll try to also provide some of the examples of the realized benefits we've seen in Canada with our use of electronic immunization registries, particularly for COVID-19 immunization. And then the bulk of the presentation really will be the review of a landscape analysis that Ava and I did as part of this broader WHO project that I mentioned on routine immunization and COVID immunization data. So we did a landscape analysis of digital immunization tools that are currently on the market. And so we'll provide some findings on that scan. We also like to discuss some product considerations to keep in mind when implementing these various products in the Pacific, and talk about some business components of electronic immunization registries. And then we'll end with some recommendations and next steps that have emerged from our analysis. So I'll just jump right into the content here, and I'm not sure everyone on the call's level of knowledge on EIRs, so this may be a little bit redundant for some, but just to kind of set the foundation here, when we talk about electronic immunization registries, we sometimes use the term immunization information system, so IIS. That's a term that's sometimes used in Canada. So these are confidential population-based electronic systems, databases that are intended to record all immunization doses that have been administered to people in a geographic area. So the focus really is on that individualized data. So where we're capturing individual demographic data, as well as individual information on each dose that was administered, regardless of where the dose was administered and by who. So in various settings by multiple healthcare providers, it would be expected that all of these doses somehow would end up in your national electronic immunization registry. And really the objective of a good electronic immunization registry is to provide people at the point of care, so these clinical healthcare providers, immunizers, as well as people higher up in the more public health kind of decision-making positions, with real-time access to good quality consolidated immunization data. And that data should be available at any time and from anywhere. We've seen that the scope of electronic immunization registries in the past has been really focused on that, just the capture of individualized immunization data, demographic data, the ability to do good immunization coverage. But I think there's been a shift in the last year, I think because of COVID-19, where the functionality that's included in a EIR has expanded to the ability to include data on AFIs. So in Canada, we call them AFIs, adverse events following immunizations. I believe in the Pacific, you call them AEFIs. Additional functionality to produce proof of immunization, either digital or paper, even the ability to book appointments. So the scope of EIRs is, I think, expanding, and we saw that in our landscape analysis. So in terms of benefits, when we talk about the benefits of EIR to the clinical decision maker, as I mentioned, having a consolidated view of an individual's immunization history at the time you're immunizing, and deciding whether to proceed or not with an immunization and what immunization to provide, having that information at point of care is an incredible benefit to the clinician. And not only just that immunization history, even having the additional information, such as whether the client has had a previous adverse event, whether the client has an allergy, if they're currently pregnant, if they have some kind of contraindication, like a medical contraindication. This is all very valuable at point of care. And then at the other end, when we're talking about kind of the benefit at the population level, just having the ability to see aggregate data in real time is a huge benefit for those who are making evidence-informed decisions. And it can be used in decisions about surveillance, operations. And, we've seen this this benefit of having kind of really real-time, good quality data. We've seen that realized in Canada. I can just give you a couple examples that have recently been in the news here in Canada, kind of like front page news, where I read that one of our provinces in Canada, because of the good quality data that's being captured at the individual level, they were able to identify specific populations that are not being vaccinated, we're seeing low coverage rates. And they were able to even identify issues such as level of education as being one of the barriers to proceeding with immunization. So having aggregate data, but also being able to disaggregate it or stratify it by demographic information, risk factors, even ethnicity, race, level of education is very valuable when you're making evidence-informed decisions about immunization program delivery. So some other EIR benefits that have been identified, and these come from the WHO classification of digital health interventions. So I'm not going to talk about all of these, but just kind of call out a couple that are of interest. So I think the information benefit is quite a tangible benefit, one that we can easily see, that when you have the ability to record reliable, good quality data, and have that data available and accessible by people at point of care and decision makers at the Ministry of Health level. That's a very tangible benefit of the EIR. Kind of going hand in hand with that is the quality piece. So by having that access to information, as I mentioned, it really can improve the quality of the care delivered by the person who is actually immunizing. So being able to see that comprehensive immunization history, identify gaps in the immunization history, is really valuable in providing good comprehensive care. The other piece with quality that's really interesting is that the quality of vaccines, the ability to really identify if there are issues with vaccine safety, greatly improves when you are tracking detailed information like lot number or batch number, I believe is what you call it, expiry date on each product that's being administered. And that really does help identify if there are issues, quality issues with vaccines or safety issues. In terms of utilization, so EIRs can actually increase uptake of vaccination services. So you're able to identify people who have not been immunized. You're able to improve adherence to vaccine schedules. And we've certainly seen this in Canada as a benefit of our EIR implementations in some of the provinces where nurses are able to identify students, particularly who have not been immunized with their childhood immunizations and have not received their school-based immunizations, and then can identify those unvaccinated individuals and follow up with them to see if they would like to attend a catch-up clinic or attend the public health unit for an immunization. And then the last benefit that I think I'll call out is cost. Now, cost is an interesting one because, of course, upfront costs are large for EIR implementations. There are upfront and ongoing costs, but there has been some really interesting literature that's emerged in the last couple of years. I think it's mostly literature from the US where they've actually been able to identify the return on investment of EIRs. And this was, in the last maybe like 5 years or so, we're only able to see some of these studies come out, and it is showing that there is that cost benefit to implementing an EIR. I can try to actually find those studies and send them out by email if people are interested. Okay. So that was a little bit of just the background, basic background on what EIRs are, some of the benefits. I'd like to get into the content on the actual landscape analysis that we conducted, and just provide you with a bit about the purpose, the scope, and some of the findings. So as I mentioned, we conducted this landscape analysis as part of a larger or broader WHO data management project to support the COVID-19 and routine immunization project. So I think somebody needs to go on mute, if possible. Thanks. So we conducted this landscape analysis to just identify and assess any current digital immunization tools that are on the market to support the COVID-19 vaccine data management, but as well as routine. And we did have the Pacific context in mind. And the intention of this document is really to provide a reference to inform countries and stakeholders as you're making decisions on the implementation of EIRs. We're hoping that this landscape analysis will be able to be used in conjunction with some other documents that already or have been developed. One being a Pacific reference immunization data model that our team is working on and can be used in conjunction with this landscape analysis to inform the path forward. There's also been in the last, say, couple of years, some really good documents from PAHO, an EIR implementation guide that's referenced in the last slide of this deck, as well as a really recent publication by USAID on EIRs in low and middle income countries. So this is where kind of this analysis fits in. It's intended to be a reference document along with the other really great guides that exist out there. I did want to put in the caveat that we're not endorsing a particular solution. So we will not be providing, a concrete recommendation on which solution to adopt and not adopt. And we're also not really advocating for digitization, which, after I talk about all those EIR benefits, in some cases, in some countries, digitization and going with a new, shiny EIR may not be the right solution for that country. Sometimes low-tech solutions are pragmatic, and they are the right solution and the right fit for the country. I think we all know technology is not the solution. It's a part of the solution, and there's many other elements that need to be considered when making the decision to move forward with an electronic immunization tool. So in terms of the methodology of our landscape analysis, so we did identify products through a couple of means. One, we looked at the publicly available information, whether it be great literature from vendors or other organizations, some of the studies that I mentioned from PAHO, one from Village Reach that also did a scan of some immunization products in low and middle income countries. We did look at some of the peer-reviewed literature. Our team, it has some good internal product knowledge that we leveraged as well. We also looked at some documents that Katri's team from the WHO provided us. And then to get some insight on products that are being used by the US affiliated Pacific Island countries, we had some email communication with their epidemiology field officer with the CDC that's stationed in Guam. To narrow down the scope of the solutions that we included in this scan, we really did try to focus on products specifically designed for immunization and AFI, so adverse event following immunization data capture and reporting. So these are like your traditional EIR and AIS tools. We did also expand the scope to look at any tools that were being used for APHE surveillance, so active APHE surveillance. These would be things like kind of quick custom survey tools, messaging tools, like SMS messaging tools to actually solicit adverse event information from people who've been immunized. We did include some electronic health information systems and EMRs. So these were tools that are not specifically designed for immunization data capture. They're more general health information tools. But we did include a couple in our scan, and we limited it to systems that we know are being used by Pacific Island countries for immunization data capture. As we know, the scope of EMRs is huge. There's hundreds of products on the market. So we really limited the scope to a couple solutions. For example, MedTech, which is the EMR that Cook Islands is using for routine immunization capture. And they're using it to capture their COVID-19 immunization data. And we did include Tamanu, which is an EMR that's being used by Samoa to capture immunization data for COVID. And lastly, we also included some solutions that were more general custom survey building tools. These may be a little bit more accessible to the Pacific context as opposed to larger EAR solutions. So a couple of those were also included in the scan. So we looked at these products and we assessed them in a couple ways. And one of the ways was we assessed them against some high-level functional business components. So these are the components that we assessed the product against. We kind of saw which boxes does this product check off. And these are kind of the high-level business components we looked at. So does it have immunization information system registry capabilities, really the ability to track individual immunization data? Is there APHE documentation functionality, whether that be passive or active APHE surveillance data capture and monitoring and reporting? We looked to see if the products had any inventory tracking components, whether they had patient registration and booking functionality. That's an area that's really emerged in the COVID-19 rollout, where countries and jurisdictions are looking for the ability to book appointments. I can speak to that in Canada. That's been a big issue here, where the current EIR tools do not have the ability to book appointments. And so provinces have had to adopt external registration tools. Some have built integration between registration and their EIRs, and some have adopted new solutions because that new solution has the patient registration component. We also identified if products had any dashboard and reporting functionality, and whether there was any mention of the ability to produce some kind of digital vaccine certificate. I'll just go back to the methodology for a moment. Just an important note is we did not contact vendors for product specifications. So we basically used what was available publicly on the product or from our internal knowledge to evaluate the product. And we didn't reach out to vendors for costing information. So that's kind of the next step. Once countries produce a short list of products they're interested in, either through their own assessment or through putting out an RFS, that would be something that the country would need to do to obtain the costing information. So another, I guess, point to keep in mind, and if you're looking at the scan, is we did want to provide a really fulsome view of all of the products that are available on the market globally that met kind of that scope criteria that I identified. So we didn't want to exclude products that may not be feasible for adoption in the Pacific Islands. So when you look at the scan and the list of the products in the scan, you will see that there are products that are quite high on the cost side. So vendor-based proprietary solutions with high licensing costs and implementation costs. But we didn't want to limit that. We didn't want to exclude them from the scan. So they are in there. But we do have a section in the scan where we've assessed the product and identified any potential limitations for adoption in the Pacific. And we really focused on these kind of three considerations. So we made the assumption that if a product was a vendor-based proprietary solution, that it may be cost prohibitive for Pacific Island countries. We also looked at the product platform, knowing that cloud solutions are challenging to implement in the Pacific context. Unfortunately, the trend in the market for EIRs is moving to cloud. A lot of new products on the market are cloud solutions. And so we didn't want to exclude them from the scan, but we did assess whether the product was cloud or locally hosted, or it could be either or. And the last consideration that we looked at was we wanted to see if there was any proven adoption in a similar context, so in a similar kind of low middle income country context. And this was fairly challenging to find in the literature. There's not too much depth to the adoption literature and case study literature. For some products there is, so for DHIS2 we did find quite a bit, and there's good depth to the case studies there. But for many solutions, we wouldn't find more than just you know, a kind of one pager from a partner like a UNICEF report or from the vendor itself. And I think this is one area we need to really we'll look at in the future closely to see if there's emerging literature in this area. I'm hoping to see lots more case studies on products that have been implemented because of for COVID immunization rollout. So it's really a space to watch. So in terms of what we found, so we did, you know, as I mentioned, we kind of grouped the products that we found into some categories. And so there's some numbers here that you can see of the product categories. As I mentioned, we did assess the products against the business components that they may have. And, you know, very few met all of these business components, and that was, you know, expected. But we did identify a couple solutions that did meet all of the major business components. And the full, I should mention that the full details are available in the actual document. The next couple of slides I'm going to kind of skip over, but these are the details of the products identified and some of the assessment that was done. This is not the full assessment, it's just kind of a summary of the assessment to fit in the slides, but it will give you a sense of the type of products we've included and the kind of analysis. And so we did identify if a product was already being used or planned to be used by a Pacific Island country. So you can see here we have, you know, DHIS2, which is being used by Solomon Islands and Vanuatu for their COVID-19 immunization data capture. As I mentioned, we have Cook Islands using the MedTech EMR system. And we've also identified Tamanu as one of the EMRs in our scan that Samoa is using. So I'll skip through the slides here with the details of all the products. And just to kind of go to a higher level in terms of findings from our market scan. So we did identify some trends that have impacted the market of immunization tools because of COVID-19. So I think one of the impacts of COVID-19 on the immunization market is that it's no longer niche. It used to be that there weren't all that many, you know, EIR products out there, and I feel like there's been in the last year just so many new, you know, big and small technology players entering the public health market. So we've seen some large companies with very little public health experience entering now the immunization space. So some examples of that are Salesforce, So they've been a big player in the North American immunization rollout for COVID-19. And Salesforce is not traditionally a public health or health system vendor. They are a CRM tool, so it's a customer relationship management tool, but they pivoted and they're now offering public health solutions for COVID case and contact management, as well as immunization management. So they've made a big impact on the ER space in Canada and in the US. We've also seen some, smaller startup companies putting out these kind of EIR or immunization data capture mobile apps. We've seen an influx of those on the market as well. Another trend that we've seen in the EIR space because of COVID-19 is the number of products that have emerged offering kind of end-to-end clinic in a box solutions. So this has been something that we've seen in Canada, where provinces are looking to adopt a new solution for COVID-19, a single solution that would cover all of those major business components that I identified, all the way from a client booking their appointment, even doing their COVID screening prior to the appointment, all the way to producing a digital immunization card at the end. And so we have seen a couple new products, and we've identified them in the market scan that are offering this end-to-end solution. And then on the other end of the spectrum, we've seen, instead of kind of these new big comprehensive immunization solutions, we've seen existing EHIS tools, so electronic health information system tools, being augmented to support immunization data capture. So products like, for example, DHIS2 and OpenMRS having additional functionality to add on to enhance the existing tool for COVID-19. And this is something that I think is much more achievable for low middle income countries, where implementing a brand new end-to-end immunization kind of clinic in a box solution is just not feasible. It doesn't make sense for the context. Whereas leveraging existing tools that are already adopted and being used by the clinicians who are also immunizing makes much more sense pragmatically. Another trend we've seen is a focus on vaccine safety. So this has been a really big shift in products, where we've seen EIRs not just focus now on individual immunization data capture, but also capturing detailed information about adverse events, and capturing, not only passive APHIS that have been reported, but even capturing the active APHIS surveillance data as well. And then lastly, functionality to support digital vaccine certificates. So we've seen in Canada the need for, definitely, provinces are very interested and actively looking for this additional functionality in their EIRs to produce a vaccine certificate, or integrating their EIR with a tool that could produce that vaccine certificate. So some of the other key findings that we've identified, as I mentioned, cloud-based solutions are kind of the way of the future of EIRs, and that's a trend that we're seeing. And we do understand that cloud solutions are not always suitable for the Pacific context because of sometimes legislation limiting cloud-based solutions, but also lack of connectivity or poor connectivity. But as I mentioned, we did not exclude cloud-based solutions from the scan. We've also seen products that are very robust, new products on the market that are, very comprehensive, providing that end-to-end immunization functionality. And we found that these are mostly commercial proprietary solutions that would be potentially cost prohibitive. So that said, we have identified that there are many products that we see that have been designed for low and middle income countries, and that should be explored further. There are some new products that we've identified in the scan that do have, they do look promising, and they do look like they could be a good fit for the Pacific Island countries. But there's very little publicly available use case information or proven adoption information available. So it would be a good idea for countries interested in these products to really push vendors for some of that use case information. So in terms of some recommendations and next steps, so we can't, as I mentioned, we are not endorsing a particular solution, nor do we think that there is a single right solution to be adopted across the Pacific. Really, if countries can assess their current and existing electronic health information tools that are already being used and have already been adopted, if those can be leveraged for routine immunization data capture, for COVID-19 data capture, this might make the most sense and might be the most pragmatic, as long as data quality is not an issue. They're meeting, and you're meeting your reporting requirements. You're able to report in a way that's timely, and you're able to make your evidence-informed decisions with the data coming out of these tools. Then this might be a much more feasible solution than implementing a standalone EIR that would then need to be integrated with other systems. The second point is that low-tech solutions might be the right solution. So as I mentioned, we are not supporting digitization in all situations, and that there's so many other factors to consider outside of just the technology itself. And in some cases, adopting a solution hastily might actually be more of a risk than continuing with the status quo. One thing that we'd like to see is with countries that are adopting tools like DHIS2 for COVID-19 immunization data management, or Tamanu, or even M-Supply, as Tonga has. It'd be really interesting to follow the journeys of these countries that have rolled out these systems, and to do a kind of post-COVID vaccine evaluation. Nothing with academic rigor here, something just to identify, is the tool meeting reporting needs? Are there any major issues with usability? Are there any functional gaps, data quality concerns? I think this could really help not only the country with informing their path forward, but help other countries as well in deciding which solution to go with. And lastly, of course, be thoughtful in the selection of your EIR product. I think most of us on the call are aware of that. There's lots of guides out there. As I mentioned, the PAHO guide, hopefully this tool, as well as the Pacific Data Model, the USAID document that was just published, can be really good resources in supporting countries in selecting an EIR product, or assessing if an EIR product is, if you're ready to adopt one. So this kind of is, again, following kind of some of the recommendations for the next steps for decision makers when you're implementing an EIR, and these can be found in the USA document that just came out. So really identifying your health system challenge, using an EIR readiness tool to assess if an EIR is the right solution. Next is identifying your system requirements, what do you need out of your system. Certainly looking at existing systems that you have in place that can be adapted. I think that's a key piece. And then ensuring that the design and the implementation of the EIR is in line with your national digital health strategy and roadmap. And this kind of is a follow-up slide, just identifying that there's much more to just the system itself. that need to be considered when you're implementing your EIR. So there's various environmental building blocks that are enabling factors. And so the focus tends to always be right on the solution when there's other elements that really need to be in place for a successful EIR implementation. That's it for me. As I mentioned, we do have some references, I think, on the last slide that maybe some of you are aware of already, but if you're not, they're all excellent resources to support you in your EIR journeys. So I'll leave it there. I'm not sure if there's any questions in the chat.
I don't believe we have any questions, but is there anyone who wants to either write a question in the chat or just they can ask it themselves if they unmute? Doesn't look like it. No, okay, that's okay. That was great. Thank you, Latifa. Are you able to share those slides afterwards and I can send them around, or what did you want to do post this?
Yes, I think I can share them.
Yeah, great. That would be really good because I've had a couple of people request. Yep, I've had a couple of people request if they can have copies of the slides, if that's okay. So if you want, you can send those to me and I can send them around. Yeah, so I think that was great. Thank you. I don't think we have any more questions or any questions. Last call.
It's Ian Thompson here. I'm a little bit lost here because I don't know how many Pacific Island countries don't have a system like this and are currently trying to implement one. How many islands, there's a number of islands you mentioned in your presentation that already have or are working on this. How many countries are in the situation where they are making a decision now?
Sure, I can respond to that, or Laura, if you're on the call, if you'd like to also jump in. So there are a couple countries that I'm aware of. So for example, I think Kiribati is looking for a system. You're right, there are many countries that have systems in place or have recently adopted new systems for COVID-19 data capture. But there are others that are still using paper-based solutions. And I know Kiribati is one. Laura, did you want to?
Yeah, for Tuvalu, Ian, for Tuvalu, we're actually looking, or they're looking for a more, permanent EIR, not just for COVID, but also for their routine immunization. What else? I think, I know that all the US territories are basically covered. So let me think here. I'm not really quite sure what Fiji is doing right now. What else? But I think we've covered, French Polynesia has their own. I do believe New Caledonia does as well. So yeah. So the only countries that right now that are not, automated is Kiribati and Tuvalu. But we're helping Tuvalu right now somehow, provide them with some kind of a tool, even just a simple Excel tool. But that's just to get them through COVID and towards a more permanent EIR that also will handle their routine immunization. And that may be the same thing as well for Kiribati as well, since we're guiding them as well. Back to you, Latifa.
Thanks, Laura.
Anything else from anyone? Okay. All right, well, I think we'll wrap it up there. We'll share the slides afterwards and I'll send an email out with a link to the recording, particularly for those who were unable to attend, because I know a lot of people were caught up with COVID vaccination rollouts. So we'll send it around afterwards. I just want to thank you, Latifa, for your time and for presenting that those slides, and thanks to everyone for attending. Yeah, and look out for an email coming through shortly with yeah, the slides and a link to the video.
Thank you.
Thanks, everyone. Bye.